Hi, I'm Dr. Mark Fryman, the Chief of Hepatobiliary and Pancreatic Surgery at St. Joseph Medical Center. Today's medical tutorial is on the Whipple procedure, nutrition and diet. Because the Whipple procedure is such a complex procedure, it is important to be nutritionally ready for the operation. Preoperatively, so in the pre-op period, many patients present with malnutrition. There has been a loss of appetite and frequently greater than 20 to 30 pound weight loss at presentation. Frequently the bilirubin, total bilirubin, is greater than 5 in the majority of patients, sometimes even greater than 10. These two factors clearly lead to malnutrition with albumin levels less than 3 in the majority of cases. Preoperative strategies are to undergo stenting, and we prefer the gastroenterologist place metallic stents to help bring down the bilirubin as quickly as possible. It is our preference that the albumin be above 3 at the time of surgery, or prealbumin above 18. This can delay surgery up in the majority of cases up to 2 to 4 weeks. Patients who have an increased bilirubin tend to have a decreased appetite. For this reason, our interventional gastroenterologist will typically place metallic stents although if the biliary stricture from the malignancy is very tight and a plastic stent is only possible, it is certainly better than nothing. Our patients are then given Megace to help increase the appetite. Megace is a known appetite stimulant. We usually use 400 milligrams twice a day. The patients are then seen in the office on a weekly basis. They are also seen by a nutritionist or dietitian to help prepare them for surgery, basically to optimize them. Labs are drawn weekly, checking the prealbumin and the albumin. And strategies to increase the protein intake are discussed with the patients. High protein diets help elevate the prealbumin and the albumin, key indicators of nutritional repletion. Supplements such as Ensure, Boost, Carnation, Instant Breakfast, These are all extremely important because they do have high protein, but they also have minerals and vitamins that are important to prepare one for surgery. So why is it important to be nutritionally replete for surgery? It sounds like a rhetorical type obvious question. The main reason is that the data does show that patients who are nutritionally replete heal better, are able to fight their cancer better, have stronger immune systems, one must keep in mind that the Whipple procedure, as mentioned in other videos, requires the healing of 3 anastomoses, or the most important being the pancreatic jejunostomy. We believe that being prepared nutritionally helps optimize the results and potentially decrease complications after surgery. What about post-operatively, after surgery? Most patients are either discharged home on a full liquid diet or a soft diet. By soft diet we mean a low residue diet. Majority of the patients have some degree of gastroparesis or delayed gastric emptying. Because of this, solids tend to stay in the stomach longer than liquids do. Hearty soups such as Progresso soups, for example, tend to be low in fat but do have some nutritional value. Once again, supplementation with the Ensures, Boost, or Carnation drinks are important. We tend to encourage patients to stay clear of milk products for the first few weeks and look for lactose free products. We do encourage patients to take Florastor or Activia yogurts to help restore their normal bacteria, commensal bacteria, and the normal flora, to help prevent post-operative C. difficile colitis and also have better absorption. After 2 weeks, patients can start introducing some fiber in their diet. Remember that fiber will stay, if you have gastroparesis, the fiber will stay behind, and it will also increase motility of the colon. So fiber is introduced slowly. Salads and vegetables are introduced slowly. Fried foods are avoided for up to 4 to 6 weeks post-operatively. Once again, building up your protein is important. During surgery, skeletal muscle is broken down to help heal the wounds. So in order to help build the protein stores back up, it is important to eat or take in significantly more protein in the diet. The supplements certainly are high in protein. Whey protein supplementation is helpful. Low-fat types of protein include fish and turkey, which can be well tolerated after the 2-week mark. We do encourage you to continue communications with your dietitian and nutritionist to help formulate a post-operative nutritional plan that suits your needs. If you do have gastroparesis or delayed gastric emptying, we sometimes, on occasion, will use Reglan if it is tolerated, although my preference is to use diet modification and not medication to help improve your nutritional status. I hope this helps. Please feel free to ask questions through my website, www.liverandpancreascancer.com.